everyone, I wanted to take a few minutes to share with you some exciting news about the realignment of responsibilities of members of the executive leadership team. Recently, an analysis was done of the roles and responsibilities of members of the executive leadership team, and a decision was made to realign responsibilities to allow each individual increased focus, time, and support to create and execute our strategic plans. We're creating value by focusing only on those things that matter most and that are aligned with one another. These changes were being done in response to changes in state direction with service delivery options and also in increased need that we are noticing in the community in Western New York. This reorganization primarily focused on creating business lines. So rather than having our executive leadership team members be responsible for programs based on the funding entity, we've realigned them to be related to our business lines. So you will see realignments that will involve clinical services, educational services, residential services, community-based services, and program and business development. Stephanie Guadagna, who is currently the Chief Educational and Residential Services Officer, will now be overseeing all of the educational services. Her new title will be Chief Officer, Educational Services, with responsibility for all early ed, school-age programming, the WAY transition program, and the Erie County Secure Youth Detention Educational Services. Stephanie will also have primary responsibility for setting the vision for the agency educational services. Jay Pratt, who is currently the Director of the Residential Treatment Facility, will now oversee all of our residential services. Jay's new title will be Chief Officer, Residential Services, with responsibility for our Office of Mental Health programs, RTF, and the Intensive Treatment Program, our OCFS residential program, Emergency Foster Care, and the 9 IRAs that we operate in collaboration with OPWDD. Jay will also have responsibility for setting the vision for the agency residential services. The director of the RTF, Traditional and Intensive Treatment Program, will transition to Melody Smith, and Allison Schmant will be the assistant director over both residential programs, Traditional and ITP. Mary Swigert, who is currently the Chief Clinical Officer, will transition to oversight and responsibility for the agency clinical services. Her new title will be Chief Officer, Clinical Services. Mary has the responsibility for the healthcare center and development of a strategic goal of instituting a primary care clinic, the outpatient clinic, agency nursing and medical services, pandemic response and infection control. Mary also oversees the trauma-informed care model and implementation. We are working on the creation of a neurodiversity evaluation clinic, which you will hear more about in the coming months. Mary is also responsible for the overall vision for agency clinical services. Sheila Hunt, who is currently the Chief Managed Care Officer, will transition to overseeing all community services. Her new title will be Chief Officer, Community Services. Sheila will have responsibility for managed care, health homes, preventive services, community foster care, kinship, all of our home and community-based programs, our child family treatment support services, and setting the vision for the agency community services. Sharon Kavanaugh, who is currently the Chief Community Development Officer, will transition to strategic development, a role in setting the vision for all of our strategic initiatives. She will have responsibility to research and develop for-profit revenue opportunities. She will be responsible for business planning and networking and community partnerships. Sharon will also have responsibility for new program development and workforce development. She will continue to oversee the employment services offered through WAY and Access VR. Sharon will also continue to oversee youth services with WAY Connect, Success, and Independent Living. Sharon will oversee the vision for the entire strategic direction of the agency in collaboration with the remainder of the executive leadership team. On behalf of the OLV Human Services Board of Directors and the entire executive leadership team, we look forward to working with you to continue to further Father Baker's legacy with this new realignment. Thank you for your time.